You're tuned into the Advocai Health Podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real.
Hello, everyone, and welcome back to the ASH Podcast. I'm your host, Ali, and today I will be your only host. My usual co-host, Omar, is unavailable for this recording, so we're going to try to do a solo with just me. And a topic that I think is very interesting. Hopefully you guys like it. If not, forgive us, and we'll try to go back to having at least two people talking back and forth. But today we're talking about a major moment in global health. It is the first ever UN political declaration that integrates non-communicable diseases, or NCDs, and mental health. This just happened earlier this September at the UN General Assembly, where world leaders showed a lot of support for this. And I heard about it through a WHO news release, which came out on the 26th of September, so only a couple of days ago. So I will share the news release on my screen and mostly have that up going through the information in that, because I think it's easier than trying to scroll through the entire declaration. Neither of the pieces are actually very long. I will link everything in the description, and I recommend please go read it out for yourself, because I think that's the best way for everyone to get informed. Just to preface, I'm not an expert in this. I don't have any secret contacts in the UN or the WHO to get any, unknown information. Anything that's out there is what I'm going to be talking about. So I think if anything I do say is a mistake, or if I'm misunderstanding something, if I'm wrong, please do reach out to us. Please let us know, because we're always trying to do better and we're always trying to learn. So if you want to reach out to us to let me know that I messed up, feel free to, through our Instagram, through our website. It should have a couple of different ways to contact us. Before I get started, I'll just let you know, I'm going to walk through what the declaration says, specifically what's said about it in the press release, why it matters, what's most importantly going to look like in terms of realistic change in the national health system, some funding priorities, and some accountability frameworks. And I think I'll also draw on some past NCD efforts, because I think it's fair to say this is not the first time the world has promised us bold action. So it's a question of, can they actually keep it going? Okay, I'm going to start by sharing my screen. All right, I'm trying to do a side-by-side thing. Hopefully this works. Apologies if it doesn't. I'll also get rid of this so you don't see me 4 times over. All right, leave that here at the top. All right. So here I'm going to share my screen, and just to set the stage, I'll show you kind of everything that's going on. So this is the WHO press release that happened with the headline of, let's scroll down a bit, world leaders show strong support for political declaration on non-communicable diseases and mental health. Before I start talking about this, I will just show you, this is the letter from the president of the General Assembly on NCDs. Like I said, the assembly took place early in September on the 5th. It's just, there's the draft. It's not that long, only like 3 pages. So I think it's a quick read for anybody. It's just hard for me to scroll through and talk about it. I think it gets confusing. So it's best if I just keep on this page. All right. Coming back to this topic of non-communicable diseases and mental health. I think this is historic, to be honest, because, and if anyone's unsure about what non-communicable diseases usually are, think, heart disease, think cancer, think diabetes, think chronic respiratory diseases. Along with mental health, these things account from like the majority of global deaths and disabilities. So when you think about that, and the fact that yet for decades, global health agendas have mostly prioritized infectious diseases, maternal and child health and emergencies, it's a bit interesting. Not to say that those things aren't important. Mental health is amazing. Infectious diseases, maternal and child health, emergencies. These are very, very important things. But what I was trying to say is that mental health and NCDs shouldn't take a backseat to this. So now we're seeing for the first time that this is being integrated into one political declaration. That means it's not just some, surface, baseline technical WHO guideline, but it's reaching the highest level of political commitment in the actual UN General Assembly. So I think that's very important. I'm gonna scroll down the press release a bit more and highlight something. Hopefully you guys can see me highlight it, but here, I'm gonna read this out first. The declaration sets global targets to be achieved by 2030. I think that's very important, including 150 million fewer tobacco users, 150 million more people with hypertension under control, and 150 million more people with access to mental health care. I think this is amazing. This is a powerful tool. They are giving us concrete numbers and a timeline. And that's very good for communication standpoint. It's very good to, attract readers. But there's a lot to unpack in it, right? I'll go step by step on all three targets. Looking first, there's tobacco use. Global tobacco control has had good momentum since the WHO FCTC treaty, but reducing 150 million users in 5 years requires taxes, regulations, strict enforcement, and there can be setbacks, there can be backlash, there can be resistance from countries around the world. Regardless of the reason, I'm not going to speculate what's right or wrong in this scenario. I think it's best to keep more of a neutral standpoint, but countries and people around the world have, a cultural background in tobacco use, maybe something traditional, something that's socially more accepted. And these are big industries, right? And with big industries comes industry pressure. So it's not unfathomable to think that there will be some sort of resistance on this. But that's just food for thought, right? Hypertension control, another amazing thing that I would love to see happen, because hypertension is often considered like a silent killer. So bringing 150 million more people under treatment means scaling up primary care, medicines, diagnostics, and you need to focus on low and middle income countries, because yes, it could be done by just focusing on high income countries where all those resources are already available. You just have to scale them up slightly, but that doesn't help a lot of the people who need this help or need this assistance but can't get it because they lack resources. So I think that's going to be the hard part there. And then in terms of mental health access, this is groundbreaking because, mental health is no longer being sidelined. It's no longer something that's left at the back. I think 10, 15 years ago, it was definitely something that people didn't talk about, especially like wanting mental health access or help or, assistance. Needing that was like kind of a shunned topic in society. But thankfully, we've seen that become more of an open conversation. But access is vague. Access is really vague. Like the word could mean so much. It could mean going anywhere from community health workers to like mental health services to having specialized individual care. So yeah, I don't know. There's a lot to unpack in those goals and those targets, but I think at the end of the day, it's a good thing that they're aiming for. It's just not going to be as easy. And I'll get a bit more into what's realistic and what's not, but I'll scroll a little further down. Okay, there's not much down. This is pretty short press release, which is why I'm also going through it easily online so that, it's easier for whoever's watching this to kind of follow along rather than going through multiple pages. But right here, I think I'm going to just highlight that a bit. I'll talk about that paragraph for a second. We see that like the WHO release talks about how the declaration has broadened the definition, like the set of NCDs that they're focusing on. It's not just the big four. They're looking at oral health, they're looking at childhood cancer, liver disease, kidney disease, and rare diseases, right? It's all right in these last two paragraphs. Which, I mean, as someone who started a rare disease club, call it a nonprofit, call it, I don't know, a student-led organization, but we started this because we wanted to bring or advocate for rare diseases that weren't really well known. So I'm glad to hear that rare diseases are in the conversation. But what I love about that part is that they acknowledge environmental and digital determinants. So things like air pollution, clean cooking, hazardous chemicals, and digital harms. such as which is usually considered like excessive screen time and misinformation. But what I love about this is that it's very relevant to today. Like, it's new. 10 years ago, you wouldn't expect the UN to link like TikTok and Instagram overuse with NCDs and mental health. But here we are, right? This is very much today's world. I mean, I was born in the early 2000s. I grew up without like social media, but now with it being so available, I have that issue of like, it's affects my ability to focus. I'm like, I have a lack of attention because it's so easy to just keep scrolling on my phone. And it's like, your attention span drops. And I've seen that in the last like 4 or 5 years with me. And I'm now actively trying to, force myself out of that. So I can't imagine what it's like for someone who's, a parent of a child who's just born in the last, like, let's say 5 to 10 years. And that's all they've known, right? They've grown up with this. I mean, we have the concept of iPad babies. It's easier to catch their attention. It's easier to, get a child's attention. And I'm not trying to, shame or, judge anybody. I'm not a parent. I do not know what it's like to try to, entertain a child while having to deal with everything else that you may have to be dealing with as a parent. So I can understand why people do it, right? So that's not what I'm trying to go against. What I'm just trying to say is that I'm glad to see that the UN is bringing this into the conversation because it's something very relevant to today's society. So this is a very good thing that I like about this declaration. But now we're going to go back to the topic of what is realistic and what is aspirational, right? And I'll kind of just leave it here on the press release because it shows sort of the targets and stuff like that. But just in case you didn't know, I am following some sort of script that I have written out for myself because I can't just free talk for 30 minutes. But in terms of what's realistic, you're looking at expanding hypertension treatment through primary care. Countries like India, Ethiopia have started large-scale programs for this. It is realistic. It's not going to be easy. I think even Canada has a shortage of primary care physicians. So, if a first world developed nation is already struggling with this, it's not going to be easy for, a developing nation to then make that shift. And then integrating mental health into universal health care packages or coverage packages. I would love to see that. Genuinely would love to see that. I know that some countries already do this, so scaling is possible. But I think mental health, with the conversation that it is now, needs to become something that is more readily available. So putting it in your universal health coverage packages, I think would be an amazing thing for governments to do. On a separate note, I wish all governments have universal health packages. Some don't. They have more privatized systems, which is unfortunate. I think health should be a basic right, but that's a different topic. And lastly, the ideas of air pollution and clean cooking initiative. I think this is very realistic because these are often donor-backed, politically acceptable. So it's very easy to get funding for something like this. Moving on to things that I think are aspirational or tough, right? We have the fact that you're looking at 150 million targets. This is ambitious. Now, they have 3 targets and they have 150 million people targeted in each goal. That's not saying that you're looking for, 450 million people in total, because you can have the same person in multiple goals. But even then, 150 million is a bit ambitious depending on where you're trying. If you're trying it, like I mentioned earlier, in only first world, developed nations where the resources are ample and, it's just about shifting a couple of budget things here and there, might not be that hard. Doing it in somewhere else entirely, that's where it might be more needed and might matter more on a global scale in terms of adjusting, debt tolls. That could be a lot harder. With this also comes concepts of stronger health taxes on alcohol, tobacco, sugary drinks, which the WHO supports. But we've seen these things take a bit of a back seat because industry lobbying is intense, right? The draft declaration, I think that I showed you guys in a link, even this has softened language compared to earlier drafts. I'm not going to link everything just because it'll just be confusing in the description, but please go online to see, see for yourself. It's not a secret that, you come up with a declaration, you come up with a policy, it has as a draft or something, it goes out to your stakeholders or whatnot. And then if it's affecting industries that are major conglomerates that are making a lot of money, that are more or less affecting your federal tax and stuff like that, they're going to have some say on it. So I wouldn't be surprised if things, don't stay up to their actual targets because of things like that, especially with factors of regulating e-cigarettes, food marketing to kids, or front of the pack labeling. These can have uneven adoption depending on where you are in the world. So that's another factor. You're an organization as the UN. You're trying to govern things almost on a global scale. Not going to say almost, you pretty much are, but you then have to appeal to everyone to actually pass these type of policies or these regulations or these declarations. And different areas, different countries appeal or will reject different parts of the document, so it's hard to appeal to everybody. So while this is a good tone to set, having this declaration, implementation of it will be messy, it'll be political, it'll be uneven. There's no easier way to say that. It's not going to be an easy way to go. But I think the biggest issue is about how will this affect money, right? And this actually brought me to this part of, I'll highlight this, but the title for the declaration, which is under consideration, is, I'm going to highlight just the title actually to make it less confusing, is Equity and Integration, Transforming Lives and Livelihoods Through Leadership and Action on Non-Communicable Diseases and the Promotion of Mental Health and Well-Being. That's a bit of a mouthful. But I think the part that I was intrigued by was this whole leadership and action. Leadership and action still comes with financing. You need financing. You leaders can't do anything without money. So the question is, how will money shift to make these things work? Most common idea is the fact that countries are going to earmark a part of their health budget for NCDs and mental health, right? Mental health programs. But, if you're taking money from one end of the health budget to another or creating a new section to put it into, you're still in a limited fund. A health budget is a limited amount of money, right? You can't print more just for the sake of printing more. That's how we get inflation, worsening economy, the value of a currency dropping, etc., etc. But again, different conversation. We'll try not to go into that too much because that's a sad talk. But so you have a set amount of money for your health budget. So where are you gonna take that money out of? At the end of the day, there's gonna be a loss somewhere. May not be a major loss. You can still make adjustments, but to create a different fund for these initiatives, then you have to take out some money from somewhere else, and it's a loss gain process. So, but then you have the concept of donors, that could prioritize integrated projects, but then you can't silo mental health anymore in that. Health taxes could also be a good way to generate domestic revenue if that is politically feasible, and it has to be reasonable as well. If you are increasing health taxes, then more things maybe need to go under universal health coverage. You can't have increased health taxes but then also have privatized health where people need to pay out of pocket and from private insurances, because then where's all that money going? So on national strategies, I think many countries already have plans or for non-communicable diseases. It'll just be a pressure of how do they integrate mental health in this, whether instead of doing something separate, which actually could be good because it can help with efficiency in terms of financial spreading or financial divvying. But the biggest thing on top of all of this is accountability. So one of the biggest things about the declaration is that it doesn't really enforce anything. It's not legally binding, and there's no real punishment. So progress will be on a voluntary reporting basis with civil society watchdogs keeping an eye on their government or spending. and maybe peer pressure from society, which I think honestly works well to some extent, as long as you don't go for the whole like revolutionary anarchy. In some cases, it might be needed, but for, let's say a civilized manner, society pressure can make a lot of difference to how a government acts. But most likely, the WHO will just publish progress reports, which just becomes a game of like naming and shaming countries that don't enforce these things, which is not really an enforcement tool. It's just kind of I don't know what to call it, to be honest. It's not legally binding for anything. There's no real consequences. Yeah, it's not the best way to do things, but what else can we do? I mean, we've seen in the past where like things, whether it be with the World Trade Organization, or the amount of finances countries are supposed to donate to the WHO or UN, things like that, where if you don't do it, there's not really much of a punishment for it, which makes it easy to get away with. But how else can I don't see a declaration like this being very legally enforced with like proper punishments. I think we're just gonna have to figure out how this is gonna work, and that's where like maybe taking lessons from the past helps. So in terms of past NCD efforts, past declarations, we've seen past declarations for NCDs in 2011, 2014, and 2018. That is a 7-year period with 3 declarations. Now, I'm not going to say I've gone through every declaration that's come out, because it's not, again, not an expert. I've done like some research, not a lot, so I could be wrong when I say this. But 2018 to 2025, that's 7 years where I've only seen one NCD declaration come out. Is that a problem? I mean, I'll leave that up to everyone individually to decide. Like, you see that as a problem? The fact that there's not been much work going on. So just lofty words, little accountability. But I think the fact of the matter is, even when you look at something as well known as the like SDG goals, the Sustainable Development Goals, and even they have a target for reducing premature NCD mortality. Most countries have fallen behind us, right? And I'm actually gonna show the SDGs and kind of go through it, because I think there's an important topic to go about here, which is that, okay, the SDGs are 17 goals that came out. I think they came out in 2015, early or right before 2015. Again, correct me if I'm wrong, search it up yourself. It's a quick Google search. I just don't want to do that right now. But you have 17 goals, 169 targets. That's a lot, right? These stem for no poverty, no hunger, good health and well-being, quality education, gender equality, clean water, sanitation, affordable and clean energy, decent economic growth, industry innovation, infrastructure, reducing inequality, sustainable cities, responsible consumption action, climate action, life below water, life on land, peace, justice, and strong intuitions, and finally, partnerships for the goals. Now, I mean, yeah, you can search these up pretty easily. It'll give you a good history on everything. Where, like here, yeah, I want to talk about this, which is, they mentioned, if people didn't know, the SDGs actually started out as the MDGs, or the Millennium Development Goals, and they were originally just 8, right? And they were supposed to be completed by 2015. Now, what happened was basically we got to 2015 and we're like, okay, this is not working out. None of these are going to be worked out. None of these are actually going to be completed. We're not going to meet our target. Well, let's set another target, more detailed, which is great. I think more detailed, the better, on what their goals are and what they're trying to achieve. We'll call it the Sustainable Development Goals. Give ourselves another 15 years to try to get it done. So these also have a deadline for 2030. 2030 is less than 5 years away. We're like 4.5 years away from 2030. Ask yourself, do you see any of these goals being achieved? Right? Even like some of the relatively easier ones. Like right now, I think we're in like a global recession. So goal number 8 isn't working out. I don't know if it'll work out in the next 4 years. It might. That's something that could change. Clean water, not everyone has access to in the world. Gender equality, I think we're getting there. I think we're doing a lot better. It's a lot more in the conversation. We can still do better, right? I think we're not at proper gender equality yet, but I think we can do better. Quality education, we're getting better at that. Zero hunger, no poverty. Yeah, not happening. I don't see that getting fixed in 4.5 years or less than 4.5 years. I don't know. Let me know if I'm wrong, but I don't see that working out in that timeline. So the point of me going through that is the fact that without strong follow-up, declarations fade. And this is where you need like a civil society to keep everything going, keep pressure on governments. The NCD Alliance is another group or advocacy group that kind of does that, which is great for the current declaration that I'm talking about. But I think generally we come from like the world around us is the fact that governments are supposed to serve their citizens, right? On a completely separate note, it's very easy for people to be corrupt or get corrupt with power and, just let that go crazy. So if you don't stay on your government, actually do things for you, it's very easy for them to go on a completely separate note. In saying that, I'm not recommending or suggesting that everybody go through like a revolutionized anarchy mode where you're just against the government. But I think a very important clip or quote that I saw recently was someone saying or stating that no actual like national ideal has ever been changed by voting or through a vote. The idea of that, I think, is what means to say is like just voting for a different party never really changes anything in your government. The national ideals, the issues that have been going on, they don't necessarily get fixed unless you get on the government to actually do something. Just going in and voting isn't always enough, but you have to do it in a civil manner because otherwise, yes, anarchy, revolution, chaos. And we're seeing some places in the world that have fallen into that, some places that haven't yet. But if you look at global conflicts, opinions that are happening, you have seen with proper public or citizen pressure, governments have kind of woken up to things and changed their ideals. I don't want to get too much into what I'm like exactly with examples of stuff, because I think that's a whole different conversation that I don't want to, I don't want to change the whole topic of this podcast, this episode. But I think that's a good example of what I mean when I say that you have to keep people accountable. And the last lesson that I think is to learn from past declarations on NCDs or other UN declarations is that industry interference is real. Food, beverage, tobacco, alcohol companies, etc., will push back against stricter regulations. In the past, when things were illegal, people were still, making money off of selling, alcohol, weed, or marijuana, let's call it, etc. So just banning things is not as easy. Governments also did legalize a lot of these recreational drugs or alcohol use so that they could tax it and then make money through federal revenue or federal tax revenue. I mean, that's why we got rid of prohibition. That's why more or less, I believe Canada legalized marijuana. But the fact of the matter is industry interference is real because these people are making a lot of money off it. Industries are making a lot of money off of these products. So they won't want to reduce customers. And the interference part comes from the fact that they generate a lot of federal tax. And that's a lot of revenue going towards the government. So that's not something they're going to want to release either. So at the end of the day, it's just money, right? It's all a money game. These industries aren't going to want you to reduce or do anything that messes with their money. So sorry to go on a bit of a rant there, but for this declaration to succeed, governments and civil societies need to keep up momentum in a way that the spotlight doesn't fade on this declaration after the UN or after this declaration comes out. In 2 weeks, we don't want people forgetting about this, and we want these targets to actually be achieved in the next 4 years. All right. I've had a lot of my screen sharing for a while now. I know I didn't really go through this document much. Like I said, it's kind of hard to scroll through and talk about it, but I will link everything. I will start screen sharing now to kind of just give my own I'll stop screen sharing. Yeah, I'm gonna give my own sort of talks about the risks and critiques of this declaration. So let's be honest. Firstly, declarations can be diluted. So for example, some language around health taxes was watered down in negotiations, and not all countries fully agreed. So like I said, you're a global organization where a lot of your funding comes from the countries that you're trying to govern, hence like the UN. So it's not surprising that you have to appeal to them. So, for example, the US, I think, refused support to support parts of the declaration, citing political concerns. Different countries, different political ideals, different cultural ideals, different, I don't know, everything. Trying to appeal them is going to be hard. So these declarations can change a lot very easily, which then means they won't really have the same targets and won't have the same effect. Another issue is capacity gaps. I mentioned this earlier, where, you know, low-income countries don't have the workforce, supply chains, or funding to deliver on these promises. So it's a question of how are you going to manage that? And finally, equity. Also something I kind of touched on earlier, which was how urban elites can benefit from better NCD services pretty easily. Implementing it with urban elites also shouldn't be too hard, but again, how does that help the marginalized rural communities that need this potentially more and don't have the resources and are left out? So these are all things to think about for this declaration. This is all things of like, you know, how is it going to work? Is it going to work? Yeah, I'm curious to see how it goes. I'll try to keep like updated on the situation, but it's going to be an interesting process, and it's a 4-year process. So it's not like I'm going to find out if this is going to work like tomorrow. So it's going to take some time, but I think at the end of this, I'm going to come to a closing because I have been talking for maybe 30 minutes. But there's some takeaways. One, this declaration, despite everything that I've said about it, is a milestone. It's the first to integrate NCDs in mental health with bold targets and broader recognition of determinants. That is a great thing. I want, and I will preface this as much as possible and highlight this, but emphasize this actually. I want this to succeed, just like I want the SDGs to succeed. But the fact is that history tells us that without accountability, declarations can fade into paper promises. So the real test is whether governments invest, whether civil societies keep pushing the governments to actually keep up the declaration, and whether the global community treats this as something that's more than just a symbolic promise, right? I think that's the best way to kind of end this. I will, once again, link everything in the description of the WHO release and the Rev 4 draft declaration or the letter from the president. Please go check it out yourself. Please go research stuff more yourself. If there's anything that I've said that you disagree with, because a lot of what I've said is based off of some facts from the press release and the actual declaration, and then my own opinion, right? I'm not an expert. I'm going to state that again, right? Not an expert. So don't take everything I have just on face value. Take it with a grain of salt. Do your own research. And if anything I've said is, I don't know, struck a nerve, or if you think I'm wrong, if you feel like I misunderstood something, if you want to correct me, give me more information, anything of the above, feel free to reach out on the ASH or Adversai Health Instagram, message us. We'll try to get back to you as soon as possible. And would really encourage it because we don't want to make mistakes. We want to learn from this podcast as much as we want other people to learn. But aside from everything, thank you guys for tuning into the ASH podcast. If you found this helpful, please like, share, subscribe, and let me know what you think. Will this declaration transform health systems, or will it be another missed opportunity? Unfortunately, we won't find out for some time, but until next time, stay informed, stay engaged, and please keep advocating for health community. Thank you.